can vitamin D protect against infections, and especially respiratory infections such as SARS-CoV-2 infections, COVID-19? This is a very important question, obviously, and I'm going to show you now a paper which explores this question, and there are some very interesting results here. And in this study, they looked at a relatively large cohort of patients, people who were infected by SARS-CoV-2. So let's have a look at what this paper says. Comment, let's have a discussion on this. Like the video, subscribe to the channel. What is your experience with vitamin D? Do you take vitamin D supplementations? How often do you expose your skin to the sun in the spring, in the summer? Let us know where you live also, because that's quite important. And let us know if you have been infected by COVID-19 and if you have also measured your blood level of vitamin D. Let us know all of this in the comments below, and let's have a very interesting and meaningful discussion. It is well known now that many cells in the human body express vitamin D receptors, and this is especially true for respiratory monocytes, macrophages, and epithelial cells, which means that vitamin D may have an important role in protecting against respiratory infections. Some papers have discussed this, and we're going to look at what these results, which are from 2020, tell us. Okay, so this was during the first wave of COVID. And the results are very interesting because in these papers, they looked at the vitamin D blood level of a large number of patients from all ethnicities and from all the states in the United States. Okay, so from north to south, east to west. And they compared the number of people who were infected by SARS-CoV-2 as a function of their blood level of vitamin D. Moreover, the authors write in these papers that an important action of vitamin D is also to suppress excessive cytokine release, okay, which is also called cytokine storm, and which has been observed during COVID-19 illness and also during vaccination against COVID-19. I am not going to talk about this specifically here, but this is a very important topic as well. And if there are enough people who are interested in discussing this in a separate video, let me know in the comments below, and I'll be happy to discuss this in more detail and to show you some new results from the scientific literature. So let me know in the comments, all right? So let's get started with this paper here. And as you will see, the results are very, very telling. So let's see what they say. So as I said, this was a large cohort, nearly 192,000 patients, a bit less than 200,000 patients from all the 50 states of the United States, and including the District of Columbia. The median age was 54 years, okay? They were 68% female, and also they had patients with different ethnicities, white, black, Hispanics. So one of the main results of this study is that there is an association between a lower SARS-CoV-2 positivity rate and a higher circulating 25-OHD level, which is the vitamin D circulating level in your blood. And here they give the numbers. You're going to see there is a very, very interesting graph I'm going to show you in a second here. They show that the decrease in positivity rate associated with 25-OHD levels appear to plateau at value around 55 nanograms per milliliter. Okay, so that's an interesting finding here. 55 nanograms per milliliter is a good level. I consider it is pretty much optimal. 55 to 60 is pretty much optimal for most people. However, a large majority of people all around the world have actually much, much lower values than this. So you're going to see the association to positivity rates now. So here you can see the association between SARS-CoV-2 positive rate and 25-OHD blood level in nanograms per milliliter. This is very, very interesting. So 20 here is very low. If you are below 20, you are considered deficient in vitamin D. 30 nanograms is considered sufficient. If you are 30 or above, it's considered sufficient, which does not mean it is optimal. And as you can see, these numbers increase all the way to 60. Some people have levels which are even higher than 60 and which have not been reported here. They had a cutoff at 60, but some people are higher than that. As you can see, there is a very clear negative relationship between positivity rate and 25-OHD levels, okay? And there is a clear decrease in the positivity rate as you increase your vitamin D blood level, going from roughly 12.5% here, 20, which is considered deficient, to about 6% or so when you reach 55 to 60 nanograms per milliliter, which seems to be pretty much which could be optimal for most people. I'm not going to say this because, there are many other factors that come into account. Of course, vitamin D is one important factor, but there are many other confounding factors which have not been taken into account in this study, which are very difficult to take into account because there are so many different factors that could influence. And that's what they wrote here. There was a strong correlation between the 25-HD levels and positivity in each of the groups. Okay, so that's also something important. In all the groups, white, Hispanics, blacks, there was a very clear correlation. And you can see this correlation here. For different ethnicities, there is clearly decrease. It's always, as you increase your vitamin D blood level, there is a decrease in the positivity rate for each of the different groups here. Now you're going to see there is also a very clear correlation whether you're a male or a female. Now, the authors write here that this finding is not surprising, given the established inverse relationship between risk of respiratory viral pathogens, including influenza, and 25-HD levels. And there is some literature published on this. Let me know if you want to know more, if you want me to look at these papers more specifically and discuss them in a separate video. The authors even give a relationship between positivity rate, between the risk of being positive and the increase in vitamin D blood levels. Okay, so this is rather interesting. They give a 1.6% lower risk of SARS-CoV-2 positivity for each nanogram per milliliter increase in blood vitamin D levels. So that's very significant, 1.6% lower risk for each nanogram per milliliter. And they also noted that, and they also wrote that this is quite similar, in fact very similar to another paper who found a similar action of vitamin D on other respiratory infections, seasonal infections. In this graph, they also show positivity rate as a function of vitamin D blood level for different ages, so below 60 and above 60 years old. And as you can see, the relationship holds for each group, for these two groups, whether you're above 60 or below 60. The same thing whether you're a male or a female. So in conclusion, SARS-CoV-2 positivity is strongly and inversely associated with circulating 25-HD levels, a relationship that persists across latitudes, races, ethnicities, sexes, and age ranges. And the authors also recommend responsible vitamin D supplementation. That was a paper with main supervisor Michael F. Olick, who is a very well-known expert on vitamin D and infectious diseases from Boston University. And this was an early paper, September 2020. The data I showed you is from the first wave of the SARS-CoV-2. And even though it's a paper which is a year and a half old, the data is still very solid, I think. There is a large cohort. It also gives us some very interesting indications about how vitamin D can help us fight other respiratory infections. There are some papers which have been published on this too. Let me know if you want to know more about this, if you want me to look at these papers and make separate videos on this. So let me know in the comments below. Thanks a lot again for your interest and for watching these videos. If you liked it, click on the like button. Subscribe to the channel to be informed when new videos are coming out. I will be posting many more videos on this topic and other topics as well. And don't forget to also visit the StanbridgeScientific.com website, where you can find a lot more very useful information on COVID-19, the vaccines, vitamin D, and a lot of other topics under the COVID-19 tab. So go and have a look if you have not seen it yet. And you can also add your comments directly there. Okay, so we can also start a discussion on this website as well. So thanks a lot again for checking these videos and for liking them. And I will see you in the next video.